portion of the stomach will be totally defunctionalized. So we convert stomach into two segments, one upper small, one lower bigger. Then we come to the small intestine and we divide the small intestine here and take this portion to the upper pouch. Now the patient eats food. The food comes to the esophagus, goes to the upper pouch and goes to the intestine. It doesn't enter the stomach at all. That's why we call it as a gastric bypass. And because the food is not mixing here, no digestion occurs in the stomach. The digestion occurs only in the distal part of the intestine. So it is not only a restrictive component, but it also has a malabsorptive component. Therefore, it is a very strong procedure. And that is how an X-ray done after the gastric bypass. This is esophagus, very small stomach pouch, and this is the small intestine. So patient eats just 30 ml of solid food and he feels satiated. It's a very strong procedure. The patient will lose 8 to 10 kilograms in the first month, and even at 20-25 years, the patients will maintain their weight and will not gain weight. Overall, they will lose about 70 to 80% of their excess body weight. And that's the young girl I had shown you who could barely walk, and now she is half her weight in 2 years, and she can do all the activities that she feels like. And that's a lady who required bilateral knee transplant because she was having severe osteoarthritis. She was referred to us. She lost 54 kilograms. With this loss, her knee improved so significantly that she did not go back to her orthopedic surgeon. So she was saved of 2 knee transplants. She was saved of the morbidity and the cost of 2 knee transplants. So losing weight by laparoscopic procedure decreases the overall cost of comorbidities associated with obesity. And that's a girl. I've shown you the result earlier. And now the last procedure and the most popular procedure that we do now is a laparoscopic sleeve gastrectomy, which is a very simple and a very effective, a very physiological procedure. And this is how we do the sleeve gastrectomy. You can see this is so much of fat around. This patient was 140 kilograms. This is the stomach. This is the greater curvature of the stomach. And we make a very small, narrow tube out of the stomach so that the capacity effect of the stomach is gone. The stomach now, instead of pouch, becomes a small conduit. It is same in the diameter as of the esophagus and in the intestine. So it doesn't hold any food. It just passes the food. The patient feels a very early satiety. These patients lose very significant weight. It is a very simple procedure. It's a very effective procedure. You can see we hardly lose any blood in this procedure. The procedure is completed in an hour, hour and a half, 3 days of hospital stay, and the patient starts losing weight very rapidly, very effectively. In 1 year, we have seen patients losing about 40 to 70 kilograms of weight. Most of them achieve their normal body weight, and then, this decreases the comorbidities, the diseases associated with the obesity. The diabetes gets cured in about 80% of patients. The stomach, you can see, is being now divided with staplers. And this is the portion of the stomach that will remain with the patient. This is the part of the stomach which will be taken out. And this is the part of the stomach which has a hunger center here, which secretes the hunger hormone. So once this part is taken out, the hunger is completely gone. You can see that the stomach becomes a very narrow, very small conduit. It has no reservoir function now. And the entire procedure is done bloodlessly by laparoscopy. And it's a very safe, very effective, very a procedure with very promising results. And this is what the stomach is going to be. And this is how the stomach looked like after the surgery when you do a gastrographic study. And this girl came to us, lost 40 kilograms, and she had a younger sister who was 85 kilograms. So this girl was always the heavier girl in the family. Once she lost 40 kilograms and she became 63 kilograms, the younger sister becomes the heavier girl in the family. There was so much of tilt and the balance in the family. The parents came to me and said, you operate on the younger girl also, and she did not fit in the criteria of obesity. So we said, we can't operate her because she's not as heavy to require surgery. They were so unhappy. They said that I'm doing partiality, helping one and not helping the other. Ultimately, we did a big procedure, which is an outpatient procedure on the younger girl. She lost 15 kilograms, and now both of them are in the weight of 60 kilograms. These are some of the results and some of our overseas patients that I discussed. So in the sleeve gastrectomy, which is a very physiological, very simple, very effective, very safe procedures with no long-term complications, but it's a procedure which is highly technical, which requires the surgeons to be very experienced in this kind of procedure. and which has very insignificant complications. But remember that after all laparoscopic weight loss surgery, one has to adopt a healthier life, has to cut down on sugar, cut down on processed grains, and eat healthy food. There are no shortcuts. It is not that after laparoscopic weight loss surgery, you can eat whatever you wish or whatever you want. And this surgery should, this is the kind of patients when they are fitted on the operating table. This is a 140 kilogram lady. You are worried, the weight table has to take that weight. When you tilt the position, she may not fall down. She has to be fixed securely. So this is a surgery which is only for limited centers who have that kind of infrastructure, that kind of setup, that kind of trained team who can undertake this procedure and still do it safely. So to conclude, now effective procedures are available, but we still need to know that we need to recognize that we still do not know how to successfully treat obesity. The only thing that we can do is, the question we have to answer is that we can only help people maintain their health in an environment today which is so conducive to patients gaining weight with all these fast food chains coming up, all these junk food and things coming up and getting more and more popular, particularly in adolescents and in young people. When the human being started as a cave, where our ancestors had their back bulging backwards, we attained an erect posture. And now perhaps we are walking into a future where our fronts will be bulging forwards. In the olden cave age, it was the weak, the smaller, the feeble, which were worshipping the big, the burly and the strong. Society has changed now. Now it is the big and the ugly and the grotesque which will worship the thin and the slim and the beautiful. Thank you very much.
Thank you, Dr. Kriplani, for such a lucid talk. The only thing I can say that as a surgeon, when we see this type of patients, and generally all the doctor will think that is very high risk and how we can operate and all the thing is there. Now with the help of the laparoscopy surgery, all these patients can be taken up in selective centers, and the patient is out of the hospital within 3 days with such a good results. And I think more and more patients should come for this thing to come out of this morbid problems. Thank you very much, Dr. Kriplani.
If there's any question, you can allow 1 or 2 questions.
Rough cost of treatment.
Rough cost of treatment.
Well, when we look at the rough cost of treatment, we must remember that if you do not treat obesity, then the cost of treating the associated morbidities like knee transplant, like coronary artery bypass, like lifelong treatment of diabetes is going to be incurred. And once we operate on these patients, they are going to save on that money. But overall, lab band costs about 1,80,000 rupees. Lab sleeve gastrectomy costs about 2,20,000 rupees. This is the total hospital package. The cost of investigation is about 5,000-6,000 is separate.
So that means the size of the stomach is the cause of obesity. Is it so?
Sir, there are various factors. Stomach size is just one of the factors. In fact, what we are doing by these surgeries are we are fooling the system by giving them a false sense of satiety. Once our fundus stretches, it sends impulses to the brain that I'm full. So these sensors are lying only in the fundus of the stomach. And there's also a hunger hormone secreted by the fundus of the stomach. So by manipulating this, we are fooling our body system, giving an early satiety and removing the hunger. There's so many causes of obesity. Obesity is a very complex phenomenon. It is not just eating more or burning less. There are hereditary factors, there are environmental factors, there are dietary factors, and there are factors yet unknown.